And the health minister cautioned that negative COVID-19 test results does not mean all arrivals to the island are in the clear. The government has announced that visitors from the United States who plan to enter the island as of July 10 will have to be pre-tested for COVID-19. Additionally, results that are no older than 7 days from the expected time of their arrival must be uploaded to the Visit Jamaica website in order to have their applications for entry considered. The requirement of pre-testing for COVID-19 before entry to the island applies to individuals coming from states which have a high number of cases, including Florida, New York, Arizona, and Texas. Speaking Thursday at a special Select Parliament Committee on Public Health, Dr. Tufton said there remains a wide margin of error even with pre-testing.
I do not want the population to think that pre-testing is going to guarantee that one who has done a test 8 to 10 days prior to coming in means that they are free of the virus. And that's very important, because the reason why that is important is that the message around surveillance and self-monitoring is going to have to be more important, because there are margins of error, major margins of error with pre-testing. It will pick you up if you're positive at a particular point in time and rule you out. So there's a positive there. But you could be carrying the virus and it doesn't show up because of the extent to which the virus multiplies.
Dr. Tufton says pre-testing is therefore not completely reliable, which means that surveillance and personal responsibility are now even more important to protect the population.
What it would mean is that there would be a mechanism at the airport to do some testing, but not nearly the numbers, or sample collection, but not nearly the numbers that would have been the case in the early days. It would mean some of that sample collection would be shifted to the health centers. It would mean, too, that persons are going to have to comply more rigidly, and we have to continue to drive that message with the stay-at-home or home quarantine, and also to respond based on any particular symptoms that they have. They need to be self-motivated to call the doctor, visit the clinic, call the 888 One Love number, because that's when the testing would be triggered if they are staying at home during those 14 days and have issues.
Dr. Tufton says with more people entering the country now, the challenges at the island's 2 airports have increased in recent weeks.
The government acknowledges that in the last week and a half, the approach to testing at the airport has been periodically fairly chaotic because of the numbers that are coming in. And we have had to make some adjustments to try and accommodate and to smooth out the backlog in processing of individuals, the transaction time to deal with those persons.
Meanwhile, the Health and Wellness Ministry is having trouble keeping track of some persons who have entered Jamaica and who have been told to quarantine at home.
I went to a setup and I saw 2 police vehicles there sent by the Ministry of Health to find a particular individual. We located him long after we went to his home. He wasn't there. And then we went back to the setup and he was very much at the setup. He's asymptomatic, he's not moving. He was at the funeral the following day with a lot of persons. I would want to encourage Jamaicans, when people come from overseas, scorn them if necessary. If you realize that they should be quarantined and they are up and out, and they could tell me, he was at the gas station and I saw him with Master Joe, who is 80-odd years old. We need to take our health in our hands as well, because we cannot just depend on the state to enforce the law. We have far more citizens than we have state officials to do the enforcement for us. So I'm making a plea, because we would have had a situation where the number of funerals declined to almost nothing. We are now seeing set up, grave digging and funerals abundantly every day, every weekend, 2, 3, 4, 5, 6 in a community. I am begging Jamaicans to understand that the persons who you know have traveled and you see them out, report, and at a minimum, keep your distance from them.
The health minister is urging vigilance amid the implementation of new testing requirements for persons coming to Jamaica.
Those who are to comply with the rules of stay at home or quarantine, whether they are nationals or non-nationals. And, that messaging is going to have to be repeated over and over to get the population to come to terms with the realities that if we're going to go for more relaxation and normality, the risk profile is going to change and the approach to managing that risk is going to change.